For this particular cat, for the pre-medication, I used a combination of dexmedetomidine, midazolam, and butorphanol. They were given propofol as an induction agent, and then at induction, we also gave Cimbidol. The distal limbs were blocked with bupivacaine, and then prior to extubation, Onsure was given subcutaneously when I know the blood pressure is stable. On occasion, I do use Convenia as well, depending on the condition of the cat and their risk for infection. IV catheter is always placed, and then the limbs are shaved the best we can. It's really tough to shave the small little digits, so we just do the best we can. Monitor their heart rate, their blood pressure, SpO2, inhaled and exhaled CO2 respirations, and body temperature. When their feet are exposed, you really have to pay special attention to body temperature so they don't get cold during surgery. 4-point local nerve block in the distal limbs with bupivacaine. The procedure can be found in the Journal of Feline Medicine and Surgery. Uh, the author is Enomoto et al. This will help reduce the need for higher levels of anesthesia during the procedure and help with pain management after the procedure is done. Once the patient is prepped and in dorsal recumbency, an arc shaped incision is made above the paw pad, leaving enough skin to hold suture to when you're finished. The first thing you want to look for is cutting through the skin and identifying the cartilage on the end of the P2 bone. This will be your landmark for finding any fragments and other structures that may need to be resected. Right here you can see the cartilage on the P2 bone. It's usually pretty shiny, hard to miss. Sometimes you have to cut through a joint capsule to get to it. This one did not have an intact joint capsule. And then using the scalpel, dissect the soft tissue away. And then right there you can use your blade to feel the bone fragment. Next is cutting the deep digital flexor tendon if it's still attached to the bone fragment, and then gently dissecting away the bone from the paw pad, subcutaneous tissue. You have to be a little careful because you can cut through the paw pad, and those little fragments are hard to grasp. Another tool that helps are the Alice tissue forceps, sometimes if they're big enough to hold it. And then again, just using the curved portion of the 15 blade to cut underneath the bone, against the bone, so you can leave as much paw pad tissue as possible to reduce trauma. Next, there's a suture placed, kind of like an anchor. It's used kind of as an anchor to hold the paw pad to the end of the P2 bone. There's a couple different ways you can do it. I started out doing a purse string suture, but unfortunately, in the interest of time, it was quite time consuming to do that on every single toe. So I've also found another method you can use is just a single suture, one bite through the mid to bottom portion of the pad, and then attach it to the tissue above the P2 cartilage in the skin, and then tying just to provide some sort of anchor to keep the paw pad over the end of the bone. A lot of problems can occur if the end of the P2 is not covered, doesn't have some padding. It can be painful. So that's the purpose of that. And then when you tie the knot, you just try to get it above the P2 bone so it's not something that they'll be walking on while they're healing. Then next is suturing the incision. I use Vicro it does have some drag to it, but I started using monocryl and it was very irritating to the cats when they were healing. So I just stuck with the Vicro 4-aught. And I use a continuous, if the incision is small, I'll use a continuous pattern to close it. But if the incision has to be a little larger, to get out a larger piece, I will do interrupteds. Try to take uh, the small piece of skin that's right adjacent to the paw pad and attach that to the skin. Sometimes you may have to take a bite through the edge of the paw pad if you don't have enough room. That's okay, it happens. But the goal is to just keep skin to skin instead of paw pad to skin. Now the second one, again, the arc incision is made over the paw pad. Leaving just a little bit of skin so you can close it when you're finished. Compared to the other toe, this one has a little bit more tissue around the end of the P2 cartilage, so you have to gently pull it away so you can visualize it a little bit better. Every one of them is different, unfortunately. Some of them are very large bone fragments and they're easy to find. Some of them are small, some of them are in a different location. So finding that P2 cartilage is the best first step to get your anatomy. This is the fragment embedded in the paw pad, gently cutting around it, cutting that deep digital flexor tendon. This one also had a little bit of the collateral ligaments attached as well. Grasping it, like I said, can be tricky. Um, and then gently dissect it away from the paw pad. This is another example of what you may see when you're attempting to remove larger P3 fragments. In this cat, there is quite a bit of non-cornified um, epithelial tissue regrowth underneath the skin that you may have to dissect away to find your landmarks of the joint and the collateral ligaments to cut. In this case, it took a little bit of dissecting to find the cartilage of the P2 bone, which is the landmark to continue on your way. This is another example of when there's a large P3 bone fragment. This one you can see has nail regrowth visible on the outside. So again, you have to make the arc incision and then dissect through the extra tissue growth underneath, and sometimes it can be difficult, so you have to just gently dissect away and then try to find your landmarks. You can use the end of your scalpel blade to feel for the bone. In this portion, I'm using the curved edge of the scalpel blade to try to work in between the P2 and the P3 bone fragment. Slowed this down a little bit. I'm holding on to the P3 bone fragment and cutting those collateral ligaments. So then you can dissect underneath it. I don't have any videos wrapping a cat post-operatively, so bear with me here. I'd show you how to do it on a stuffed animal. So I use 3 layers of tube gauze, tape at the top, and then put a layer of vet wrap on the outside and tape that at the top as well, attaching to the fur. Leave it on for 12 to 24 hours, and then remove. These are the fragments removed from the first surgery reviewed, but here are some other photos from prior surgeries as well, just to get an idea of the size of bone fragments that can vary between patients. Two images are just a quick reminder about pain management and recovery. And I hope this helps out a little bit in removing P3 fragments, and good luck.